All right, so it looks as though many are averse to this tax that has been passed by Parliament. We are awaiting presidential assent to it, then it kicks in. But it's not everybody that is against these taxes. Labram Masaudu Musa is the Director of Vision for Alternative Development, one of the groups that petitioned Parliament to pass the Excise Duty Amendment Bill, which is one of the three bills that were passed by Parliament. He's joined us via Zoom for a quick chat on this. Labram, a very good evening to you. Thank you for your time.
Very good evening to you and your cherished viewers.
Right, to start with, you and your group were in favor of passing the specific tax, which has to do with the excise duty amendment, and then you are saying that there is good reason behind it. What really is your justification for this?
Thank you very much for the opportunity, and let me use the opportunity to thank the Ministry of Finance and Parliament for the yeoman's work, because indeed for us, we believe that this particular tax we are talking about, the Excise Duty Amendment Bill, also known as Health Promotional Bill, and also known as Corrective Bill. In fact, this kind of bill is a behavioral type of bill which seeks to reduce the untold hardship that, these products that we are talking about here today, tobacco, alcohol, sugar, beverages, imposes on us as people. So obviously, having heard this one, it tells you that indeed there's a need for government all over the globe to come out with mechanisms that would reduce the exposure of people, including the fact that this is increasing the disease burden of individuals, the economy, and even at the national level. So for us, when the bill was proposed, we were extremely happy, and we support government entirely for this passage.
And so you are not, in favor of it politically, but then on the health side, you think that because there are health conditions that are all things that lead to health complications that are going to be taxed, that's why you are in favor of this bill?
Precisely, because see, in fact, and that's why I told you earlier, excise duty amendment bills or excise duty are bills that are for promotional, health promotional consequences, corrective bills. Now, if you look at the increasing, rate at which people are dying from these cancers, non-communicable diseases, cardiovascular diseases, heart diseases, chronic respiratory diseases, these are all as a result of, our exposure to, commodities like tobacco, and other things that I mentioned to you. So normally it's incumbent on every government to look at policies like this, just so we're able to reduce, especially for our kids, so who are mostly, the target of these industries. And you and I know that currently there's a rise in non-communicable diseases.
Right.
Go to the hospital today, talk to the doctors. They will tell you that now diseases are on the increase. And the increase is as a result of the risk factors that government has currently imposed taxes on. And let me say that the taxes do, indeed, government will get revenue as well, because it's estimated from our end that when government imposes this tax, per our estimation, government is going to raise about 1 billion, Ghana cedis from sugar-sweetened beverages. It's also going to raise...
And that's where the problem is, you and many others are also of the view that this is going to put extra pressure on our pockets or the pocket of the everyday Ghanaian. Aren't there other ways we can deal with health-related products in the country rather than taxing them?
But see, that's one of the best and most recommended by WHO, by UNDP, and by many development organizations. Many countries have tried this. The Philippines, the Thailand, South Africa. Here, everybody is now going taxes, because taxes reduces. In fact, it helps to reduce the extent to which the poor, first and foremost, and then children. These are our target. The rich man, me and you probably, we've already made our mind, if you're not going to drink, won't drink, if you won't smoke. But the point is that the target of the industry has always been our children. So the taxes for us is a good measure, and that's one of the best ways that you can. Indeed, you can also create awareness. But if you create awareness and you don't have, policies or regulations to back, your policies, it doesn't go anywhere.
Okay.
What is the industry talking about? The industry is just talking about their business collapsing. They're talking about, the fact that the unemployment issue will rise. The point for us, if you look at the cost-benefit analysis,
right,
looking at how much government spend to cure for people who are suffering from these diseases, and look at how much revenue government will get. In fact, it is unmatched.
Okay.
You know, the burden is just so much. So we applaud Parliament, and we are calling on the industry to at least look at public health.
Okay.
Aspect of it, and not, always, what they to get
Aram,
from their pocket.
thank you so much, Labram Musa, who is the Executive Director for Vision for Alternative Development. Thank you for your time this evening on News 360.